So it was sheer luck for me that Dr. Morey served the military, service in South Korea for a year. Thanks to that, he gave me great advices, deep understanding of my own culture. So he's one of the true prosthetic giants, and because of that, I asked him, when I was get trained by him in the US, I asked him how to be a prosthetic urologist like you do. And he told me back that, Sean, put all your chips on the table. It was one of the most honest answer or advice I have ever heard. So, and I believe that it comes from his own experiences as well. He is such a gentleman, and he is such a modest and warm-hearted people, but never shows his temper. But everybody can see that he works very hard, and at the same time, he worked very hard. He devoted himself deeply into this prosthetic urology field, and that's the reason why he's now in this field as a giant, So, for me, he's just a big brother whom I can always count on. At the same time, I believe that goes the same to his patients as well. Once I had a Korean patient who lives in Dallas and want to get a penile prosthetic surgery, so I referred him. I told the patient to go to the Dr. Morey, and then I forgot about him. And several months later, I got a postcard from that patient saying that he thanked me so much for introducing him to Dr. Morey. So it was first in my life that my referral ever got thanked from the patients. So yeah, that's who Dr. Morey is. There's so many things I have to learn from him. So hopefully that I can keep learning from him in the future as well.
Well, men's health comprises many aspects, including the physical and the emotional health, and not only of just the patient, but you're talking about relationships. And when a man has problems with sexual function, it can affect his mood, it can affect his relationships, and really have a negative effect on his lifestyle. And so by addressing the nature of the problem, sometimes with surgery, this has the potential to really salvage the things that are important to the man's personal life. So these are some of my happiest patients who have been successfully treated in this very difficult area. Yeah, so training is very important to us, and we are a high-volume surgical center. But it's nice that when we do those surgeries, we do them in a way where the learners can take the messages and the skills along with them. And it's the old saying of if you hand somebody a fish, well, they won't be hungry that day. But if you teach them to fish, well, then they'll never be hungry. And so it's nice to see that the patients are going to receive excellent care based on the experiences that the trainees have with us. And we're really blessed to have outstanding trainees who are very eager to learn and very skilled. And so it's a very gratifying process to see young, talented people emerge into leaders in the field. Well, I just got a card 2 days ago from a patient who was so grateful that he was able to have normal, satisfying relations with his wife again after many years. And this is always touching to see the effect on the man's overall well-being. And so I think it is important. I think we're doing a better job of taking care of things like cholesterol, diabetes, or exercising. Heart disease, I think, is being managed more successfully over years. And so there is a longer lifespan in which the sexual issues can become problems. And so people, when they have a longer life, they want to have a more enriching life. So the sexual part, I think, is always a very satisfying area for the patients who receive the implant surgery. And many of them, many dozens, have told me, I wish I would have done this years ago. Well, I think there's a number of factors. Number one is that there may be a perception that it's not important, and specifically with surgery, that it may not be worthy of having a surgical procedure, which has risks. It sounds a little scary, sounds painful to the patients, when in fact, when you really explain the situation to the patients, it's a minor procedure and very safe. And usually, even in the worst case scenario, it's the patient's no worse off than they were when they first came into the office, because the surgeries are relegated for the sort of the end of the line patients when all the other treatments have failed. So we are cautious about who we offer the surgery to, and we have to make sure that they understand and have realistic expectations. Well, I think it's just making a positive difference in people's quality of life, and seeing them come in with a problem, being able to fix it. Some people have scars or deformity in their penis, and also the erectile problems, and so to be able to allow them to successfully engage in a sexual activity without having any worries about pain or problems of performance. You know, this is like a weight off their shoulder, and so it's very gratifying to be able to offer that to the patients, and to do it in a way where the learners and the residents and fellows that we have can carry those lessons forward and also create that type of impact. So this is very gratifying. Well, you want to surround yourself with people who are interested and skilled, and so in a high volume surgical center like ours, we have the same scrub nurse working with us every day, and the same circulating nurse. So they know what we need when we need it. It makes the cases go faster, and your outcomes are going to be better. You have the right tools available for even the complex cases. You know what the tools are that are going to be required. Everybody's aware of it, and so it is truly a team approach, and so we have been blessed, you know, to have those types of people, and it is important in a high volume center like ours. Well, the thing that impressed me so much about Dr. Park is that he quickly became one of the leaders in all of Asia. I worked with him first about 5 years ago, and I knew that he possessed a good basic background of surgical experience, but he has become an expert in this field, and has risen meteorically to the top of the field. And I've worked with him, and he's taught me many things too. So, you know, I've been doing this for 20 years, and he quickly has become at the same level as I am, and I have tremendous respect for his talent and great admiration for his success. And it couldn't come to a nicer person. Couldn't be better deserved by anybody. He cares deeply about his patients. He has outstanding surgical skills. I would welcome him as a partner in my own center in Dallas or anywhere, and I just can't say enough about him, both as a surgeon and as a person. Well, I should be asking him for advice, because he's become so successful so fast, and it's really it's impressive. So I think that my advice to him is just to maintain what he's doing, and continue to be an outstanding surgeon, outstanding physician, exactly like he is now. I don't see where else he can go in this field beyond where he is now. So I think the world of him, and have tremendous admiration for him.